Hey everybody, and welcome to the Dr. Mom Show. This is Dr. D, mom of three, your host. Again, I am so excited for today's show, which is Tinkle Tinkle Potty Tricks, not only because of the topic, but because of our wonderful guest that we have on today. She is going to drop so many nuggets on you today. You better get your pen and paper out. You better get Siri going so that Siri can take notes while she's talking. But before we delve into our topic today, of course, remember that the Dr. Mom Show is a medical informational resource. It does not take the place of your physician or your child's physician. So definitely seek your and your child's medical advice from your physician or your child's physician. And of course, we are in season 3 now of the Dr. Mom Show. And we have some new surprises, some fun challenges during this season. So I'm so ready to get in there. And if you've missed any of the episodes of Dr. Mom, make sure you go back, listen to those. You can listen to those on any podcast platform or check it out on my Facebook page, The Dr. Mom Show, or on YouTube at The Dr. Mom Show. So today, I am super excited to introduce, again, somebody who's so awesome. When I tell you about her, you're going to be like, oh my goodness, because listen, we only have stellar guests on this show who have, like, when they do stuff, you know, it takes up 6 pages of what they do. So today I have with me the amazing and beautiful Megan Pierson. Woo! Welcome, Megan.
Thank you so much for having me. I'm so excited to be here. And I just wanted to let you know that I have listened to season 1 and 2 of your show. I love to listen to podcasts while I'm walking or driving in the car, anything I can do to just further promote my knowledge of motherhood and all the specialists that you have on. And then just the thought that you are a wife, you are a mom, you're a mom of triplets and a doctor. You're like a superhero. So I'm so privileged and honored to be here with you.
Megan's like my new manager, just so you guys know. She just like automatically became my new manager and marketing person. Thank you so much, Megan. That means a lot coming from you, because when you hear what Megan does, I just have a lot of respect for her because of what she does, all the fields that she's an expert in. You know, there's never enough experts in those fields, and it's always so nice. And she's a mama too, so she knows the pain. Mm-hmm. She's in the trenches doing it. She's not just coming here and telling you do X, Y, and Z. She has been there, has done it, has practiced it. So let me tell you a little bit more about our special guest today for Tinkle Tinkle Potty Tricks. So Megan is the founder of Potty Shop OC, and she's also a potty training consultant, toddler sleep consultant, 2 very important things, a certified positive discipline parent educator. We all need a little discipline. And an author. She holds a master's in early childhood education, and she has extensive experience in early childhood education and her passion for assisting children and their families to lead healthy and happy lives. She's the author of several books, but today we are focusing on, yes, you can potty training manual. She has a husband of 17 years, Christopher, and 3 beautiful children, and they reside in California, nice and sunny now. But one thing that Megan focuses on and is passionate about is that she uses her experience and gives parents hope during the terrible 2s. We all know about that. And sometimes terrible 3s, because I tell you what, my kids were like terrible 3s. I got through the 2s and I was like, hallelujah.
And then the 3-nagers come into play.
Yes. And having a 3-nager, and she's your go-to girl when it comes to all things potty training. Give it up for Megan. Woo!
Thank you so much.
Thank you. Awesome. Well, Megan, tell us, how did you get into this whole potty training business and being the go-to girl for all things potty?
Right. So I started my career as an early childhood special educator, working with young children with autism. And then we started having children, and I took a year off. And then our second child was born, and she was born with a severe heart defect. And it kind of just rocked our world. And so I really we've been in and out of the hospital for over 450 days. She's had 5 open heart surgeries. And during that time, I just spent a lot of time talking with the doctors, realizing how important sleep was on a developing child's brain. And then I started really thinking about potty training, because I potty trained our, then 2-year-old. And then now I have this child that has been in and out of the hospital, has a speech delay, has a physical delay because she's been in the hospital bed for so many days. So I started thinking, how do you potty train a child that has some difficulties? And so I started talking to a lot of the urologists up at Children's Hospital Los Angeles. And that's how I started to devise my Yes You Can potty training manual. It takes you from readiness to success, and it's really geared towards every child.
And I love that, because I know Megan knows, but you guys who are listening, every child is so different when they potty train. And I like bear witness to that, because with the triplets, they're all the same age. And just so you guys know, 2 is normally when we recommend to start potty training. Some kids, especially girls, may show a little bit more interest sooner, but part of that, physiologically, the muscles of their bladder is really strong enough for them to control and to really feel that sensation, hold it, things like that at 2. So we really try not to force them, because when we force them, we also see at that age, like 2 and 3, at the start of potty training, that kids start to get constipated, because if you're forcing them, they're totally going to start holding everything in. So no force potty training, please. So yes. I bear witness to what Megan is saying, that everybody's so different, because baby girl, she was on it. Like within a week, she was potty trained, done and done. She was like in underwear. At night, we never even like potty trained her at night. She just wanted to be in underwear. And she's like done it. Baby Luke was second. And he probably took like a month. Baby Ethan was the one who was like, no, like I'm not doing this. And you know what I did? I just left him alone. I never was like, you have to do it because Alina and Luke are doing it. It's so funny, because if you see pictures, of course I took pictures. We had 3 little potties in our master bathroom, where they would just sit, so they could sit together, at least sit. We always encourage that they see you, they can sit at the same time as you, but didn't force him at all. And you know what? A couple months later, he did it, and here we are today. We're all good. So I love that. And, each parent does have their own experience, where every child isn't the same. Some kids are all about it. Some kids are like, no. And then, like you mentioned in your situation, there's so many other things that play a role in potty training. Kids who may have something like they're on the autistic spectrum, or if they do have some physical ailment that's causing them not to be on point, at that developmental milestone at that time. So I really love that you address all of that in your book.
Right. Yeah. And I love everything that you said, because that is so spot on. The one thing, if I could give any parent any advice going into potty training, is don't compare yourself to anybody else, and don't compare your child to anybody else. So even twins, I love to potty train twins. And I also like to potty train triplets. But I tell parents of twins, you have to look at them as individuals. Even though, they're twins and you think that they're doing kind of everything together, they are going to hit milestones at different times. And that is normal. So really, when you go into potty training, I always say go into potty training during a high tide in your life. And a high tide, you're going to have high tides and low tides in parenting, especially with toddlers, because they're so unpredictable. But a high tide is when life is a little bit smooth. You don't have, life isn't too rocky. You're getting along with your toddler. Whereas a low tide is when you might have a move coming up, you have a new baby coming, or you just had a new baby, your child's starting a new school. So those are going to be low tides, when you just kind of want to hold tight and wait for that high tide to jump into potty training.
Yeah. And so important. again, some kids, I'm gonna call my sister out here. My sister used to like to use the bathroom next to a flower pot that my grandma had in her house. So beware, parents. They may not want to go in the potty. They
Yeah.
might find a special spot that's their comfort potty spot. But you know what? It's a starting place.
Mhm.
But I really love that, and I think being a mom of multiples, it's so blunt that every child is not the same, and you
Right.
really, whether you have multiples or kids who were born at different times, it doesn't matter. You really just have to try your hardest not to compare them, because
Right.
every child, each one of us are so different. We're made in such a special way.
Mhm.
So and potty training also is not an exception to that rule, that we also do those things differently.
Right.
Well, what are some things that parents, if somebody's listening and they're about to start potty training their kids, or they're in the middle of it with daytime, because daytime potty training is
Right.
normally what we start with. So what are
Right.
some things that parents can do if that's the stage they're in right now?
Okay, perfect. So I always start by talking about positive body associations, and that these are things that you can start doing when your child is, not ready to start potty training, but you're starting to think about it. So anywhere between 15 to 20 months, just starting to, like you did, get a small potty and have it in your bathroom. You want one per child. So if you have multiples, you definitely want one little potty per child, because if not, they're going to want that one potty at the exact same time. So just get a small potty. Let them see you in the bathroom. Let them, help you flush the toilet. Talk to them. Start talking about the terminology that you're going to use. Those are all things you can just start doing before you dive into potty training, because the more comfortable your child is going into potty training, the easier your time will be. So that's kind of what you're going to do prior to potty training. And then there's a lot of readiness skills that we look at. I divide it into physical signs, emotional signs, and cognitive signs of readiness skills for potty training. And I do not typically like to officially potty train a child until at least 22 months. Like you said, the brain bladder development is not, it's not fully developed yet. So until around age 2. So before age 2, you're working on all the fun things, role playing, having, your child put the doll on the potty, getting comfortable with the potty, everything we just talked about with positive potty associations. Then you want to start looking around their second birthday. Okay, physically, are they able to, with assistance, a lot of toddlers will need assistance, but pulling up and down their pants? Are they holding their bladder for, at least 1 to 2 hours? So is their diaper staying dry for longer periods of time? And also, are they having regular bowel movements? So those are some physical signs you want to start looking for. And emotional signs, like I said, you want to be in a good place with your child. That is probably the number one predictor of success during potty training, is you are both ready and you're both feeling like, okay, we can do this together. Your child has an interest in the potty and they're able to play independently for 5 minutes or so. And a lot of times moms, especially if we stay home with our children a lot, we feel like we always have to entertain them, and we don't have to always entertain our children. A lot of times kids learn just when they're playing and exploring by themselves. So if your child is playing and exploring by themselves, that is amazing. That's a great life skill that they're going to need. So give them that space and time. And then also another emotional sign for readiness is just starting to show pride in their accomplishments. They're excited when they do something well. They love getting praise. So those are all really good signs. And then moving on to cognitive. So they're able to follow simple 1 to 2-step commands. And you can start working on this all the time at home. So, grab me your shoes. Can you get me a fork? So anything that you can start doing 1 to 2-step commands with your child will really help. And also that they have words for pee and poo. You don't have to have those exact words, but it's good to have specific words and specific terminology for potty training. And then also your child will probably start telling you, oh, mommy, pee pee in my diaper, or I have to go. So they can either start telling you before they've gone or after they've gone. Those are all amazing readiness signs that it's time to start thinking about potty training with your child.
I love all those tips. I mean, those are amazing. Audience, again, I hope you are writing this down. I hope you're recording it. make sure you share it, because I mean, these are just key things. And I love how Megan talks about that prep stage, because you really want it to be as natural as possible. You don't want all of a sudden they turn to and you're like, okay, here's the potty. We're going to sit down and do this. No, you want it to be as natural as possible. We want it not only for just sanity's sake, we want to decrease the anxiety for both parents and their child. So I love just that natural transition that you talked about, because I think that's very, very important. Because parents, if you're anxious and you get upset at your child, I mean, they're totally going to shut down during the process.
Definitely. I like to say that potty training is like learning to ride a bike. Your child will definitely fall. They're not just going to get on a bike the first time they've ever seen a bike and start, cruising. So they will fall, but you're going to pick them back up. You're going to pick them back up and put them right back on that bike. So you're going to kind of, when they have accidents, you're just going to pick them back up and try again. So, and the more comfortable, your child is with the potty, sitting on the potty. If you go into potty training and your child has never sat on a small potty or the large toilet, they may have some fear of sitting on the potty. So really start, introducing that early on will really help.
Yeah. And remember not to yell. I'm a firm believer in Potty Praise. That even when we were training them, even when I went, they'll get in, they'll say, Mommy went to the potty. So give yourself praise. Yay, we made it to the potty.
Definitely. And that's like with role playing too. So you start breaking down that, and just to remember that accidents will happen. 100% accidents will happen, and accidents are really a good part of the learning process that a toddler goes through in learning to hold and release their bladder. So they have to have accidents so that they understand the feeling.
Yeah. And I think it's so important nowadays. I feel that kids are almost, I don't want to use the word force, but almost forced, or I should say rush, to be potty trained, because a lot of schools now, when they go to daycare or preschools, they're like, oh, if they're coming into this class, they have to be potty trained. But naturally, kids have until like 5 to really get fully potty trained. So if your child is 3, we said you could start around 2, because again, like Megan talked about, that brain bladder connection, and their bladder just isn't strong enough. Those muscles are strong enough until 2. But, we try to get it done before they go to, pre-K. So like 4, if they're in daycare at 3, there's just like this standard, I feel, and it forces parents, and I think it puts everybody under pressure. But just so you know, your child is still normal. And 5 is when, if they like hit 5 and then other things are happening and they're still having accidents, then we kind of look into other things. So they have essentially until 5 or 6 to be daytime potty trained. And normally by that time, they are, unless something underlying is going on. So remember that it's not a race. They do have time to get it done.
Yes, definitely. I know in California, it's, they can go to preschool at 2 years, 9 months. So I get a lot of calls around, 2 years, 7 months. The parents are panicking, and I'm like, it's okay. Take a step back, breathe. We can walk through this. And I do a lot of work with local preschools and daycare centers in our area, talking to them so that they can kind of get on a good schedule with the children. But the last thing you want to do is put pressure on your child, because when that happens, they dig in their heels, and we do not want constipation. We do not want urinary tract infections. So just take the pressure off.
Yes. So now that we've hit on daytime potty training, what about nighttime? When is a good time for parents to start that? And what are some tips for parents in regards to nighttime potty training?
Okay, so I talk a lot about nighttime potty training and not putting pressure on your child. And that's one of the reasons I really started researching potty training, is because I was seeing that there was a trend of you take diapers away cold turkey for 24 hours in a day. And I kept thinking in my head, this can't be good for every 2 and 3 year old. I know that, every 2 to 3 year old cannot be holding their bladder for 12 hours during the night. And you just spent the last 2 to 3 years getting your child on a great sleep routine. The last thing I would ever tell you to do is to disrupt that, because you're going to be waking your child to go to the bathroom and all of that. So you will work on daytime potty training at the beginning. Yes, there are some children like your daughter that, you start potty training and they just take it and they run with it and they can hold their bladder overnight and it's easy for them. That's not the majority. So the majority of children are not able to hold their bladder for that long, for that, many hours during the night. It's very common for kids to not be overnight trained until age 4, 5, even 6 years old. And there's a genetic link to that as well. So if you or your partner were a later nighttime wetter, your child has a higher chance of being a later nighttime wetter. So you will know when your child is ready to be overnight potty trained when they go 5 to 7, either naps or overnight being dry. So until that point, you don't put any pressure on it. You want your child to sleep because sleep on a developing toddler's brain is so much more important than trying to overnight potty train your child.
Yes. So remember, guys, give potty praise and no potty pressure today.
Right.
Is what we're trying to tell you today. So give a lot of potty praise, no potty pressure. And it's so true because Alina was the one, she was in the sack by herself. So Alina was a pound heavier than the boys. She was an inch longer than the boys. I mean, she's a beast. she does not play. When she came out, she was the last one to come out. And the maternal fetal specialist, he was like, "Where did you keep her? She's huge." And I was like, "Up here." Like in my chest. She for sure is the exception because even with the boys, they had pull-ups for very long. And what we ended up doing, it became a game to them. Like one of the boys, he was like, "Oh, mama, I went 2 days and my pull-ups dry." And, so it was a game. It became something fun because we were like, and of course, Ethan, he was like, he would get sad because he's like, "Oh, my pull-up's not dry." And, we just say, "Oh, it's okay. It's not a competition." Because, they still have time. They just turned 5, lots of time. And in the medical sense, it's really until 8. Like normally kids can wet the bed until 8 and we still consider that as normal. It's until they reach 8 that we say, okay, we have to work up. There's something else. And Megan hit it on the head about that genetic component, that if there's a parent who wet the bed at an older age, I mean, the kids are just a little bit more susceptible to that. So I'm so glad you mentioned that, Megan.
Right. Yes. So just know that it is very normal if your child is still, wetting, their diaper overnight, and just to take all the pressure off. And the last thing I would want any parent to do is start setting any alarms for their child. Or, I have seen some really crazy things out there that parents have, experimented with, and always speak to your pediatrician before trying to do any, type of alternative, like therapy to get your child to stop wetting the bed.
Yeah. And definitely, I agree. Talk to your child's doctor. And the other thing is, your child's routine. You know how much they're drinking before they go to bed. You know how late they're drinking. Some people do okay if they prefer to say, like, because normally kids fall asleep a little sooner. So I do have some parents who will say, okay, because I go to bed 3 or 4 hours after my child goes to bed, I just get them up, put them on the potty before I go to sleep. And that works for them. And again, I agree with what Megan said, is that their sleep is so important. So if your child is like knocked out and can like have you sleepwalk them to the bathroom and have that not disturb their sleep, then all power to you. But if you have a child that once you wake them up to go to the bathroom, they're like up and it's messing with their sleep, I would not do that. And the same thing with the alarms, like you talked about. You don't want to interrupt that sleep, because their sleep is so important for their memory, for their growth at this point. So super important. So I totally second that sleep should not be interrupted unless, again, they're like awesome sleepers and you can just get them to the bathroom.
Yes.
One of my boys is like that, by the way. It's pretty funny.
See, then he'd be a perfect one. But, if you have a toddler
it's dead weight, but
if you have a toddler that then's going to be poking you for the rest of the night, like, I'm awake still.
Oh,
save your sanity and sleep.
That's right. Nobody wants that. So Megan's been awesome. She's giving you tips how to potty train your child during the day, had some tips about potty training at night. So I just want to hit on accidents for a little bit. So again, Megan said it, accidents happen. Accidents are normal.
Definitely.
But Megan, let me ask you, what are some concerns if a child is potty trained and then all of a sudden accidents are new? Like, what are some things that can trigger that, and how can we address that?
Okay, so yes, potty training regressions are very normal. And if your child is having a regression, the number one thing to kind of think about is what is going on in their life that could have caused this. There's always a cause to a regression. So is there a new baby in the house? Are you moving? Do you have a new nanny? Is your child going to a new school? Kind of what is going on in your child's life that could trigger this? And so once you kind of get to the root of the regression, then you can address that issue. And then you just take a step back with potty training. Go back to what you know. Go back to kind of the days 1, 2, and 3, where your child was getting, a lot of praise and a lot of rewards for going to the bathroom. Remind your child that, you know your body, pee-pee goes in the potty. So if they're starting to kind of regress, having some accidents, get to the root of the accident, and then kind of just take a step back and know that regressions are a normal part of the potty training process. And you can easily kind of glide through it if you just take a step back, take the pressure off. And a lot of times children do have potty training regressions because during potty training, they had all of your attention. They had fun with mom or dad. They were bonding. They got a lot of praise. And then they're potty trained and it's like, okay, back to real life. And that confuses a lot of toddlers. Like, wait a minute here. I want this, interaction still with mom or dad. So you might just have to take a step back and kind of comfort them, especially during today's world and with this whole pandemic. And I really believe that toddlers have been hit very hard during all of this, because a lot of toddlers, we literally picked them up from school a year ago and they didn't get to go back and see their friends. All they knew is the entire world was flipped upside down, but they don't understand why. So with older children, we can really talk to them about, what's going on in the world and the pandemic and why people are wearing masks and all of that. But with toddlers, they don't really understand. So they've just had a lot on their plate the last year. So if you're seeing regressions, and because life is just kind of uncertain right now, don't worry at all.
Yeah. And I mean, like you said, COVID's hit everybody, and it's every age.
Right.
Kids have been impacted medically, physically, emotionally. So remember your kids. I know we're all going through a hard time. People, if they've transitioned to working from home, or if anybody has lost their job, it's been huge for parents. But remember that kids too, they for sure have been impacted by this. Yeah, so I love that. So essentially, regression is real. Take a step back. It is true. If you're having a new baby, it's kind of like all of a sudden your older child starts picking up the bottle and drinking from the bottle, or sucking their thumb, or like trying to get a pacifier. So that happens. So definitely just take a step back and, like Megan said, see what has changed and what is different. Then of course, I have to put my 5 cents in here that any stress, so essential, any stressor, any change. And of course, we also think about potential abuse. So if there's a situation, so definitely we want to be realistic that if something happens, doesn't mean, because I get parents all of a sudden come in and their kids regressing and they're like, somebody's abusing my child, don't jump to that conclusion already, but know that when you bring your child to us, if you have that concern, that's always on the list. So we make sure that everything's okay. There's no new exposures, nobody else that your child may feel unsafe with. So that's something else, but definitely take all the differentials into consideration. Again, like Megan mentioned before, talk to their pediatrician and just kind of like figure it out, make that algorithm of what has changed. And again, this past year plus has been difficult for everybody. So I'm assuming more kids have regressed than normal. Right.
Yes. The number of calls I've had from toddler parents this last year for both potty training, behavior, and sleep toddlers are just, it's just been really difficult for them to comprehend all of this. They're not getting energy out that they were getting a year and a half ago. They're not going to school, running around playing. So just everything is kind of affecting them. So you just have to, take a step back and also know that our toddlers just need and all of our kids in general just need a little bit more comfort and support right now.
That's right. That's right. Well,
So.
are you working on anything new?
So, yes, I actually just finished writing a new potty training book that will come out. I know it will come out
Heard it
August
first
17th.
right here on Tinkle Tinkle Potty Tricks.
Yes, I know. So I just finished it. It's kind of gone through the editorial phase. So it will be
Is
a
it
book
going to
geared
be
towards.
Yes You Can Potty Training Manual Part 2?
So this book will be geared towards first-time moms for potty training. So definitely keep your eye out for that. It'll be sold, I think, pretty much everywhere starting August 17th.
I love it. So you guys, Megan's information is on here. If you're watching, if you're listening, I'll have it in the notes that you can buy that book. Mother's Day just passed. Still, we should always celebrate our moms in any case. So if you know a new mom, for sure, definitely get her a copy. I think it's something nice for new moms because babies don't ever come with manuals. So it's always nice to get whatever help we can. And what better way from an expert in potty training, and again, somebody who's been through it herself. So excited. Congratulations on your new manual.
Thank you so much. Yes, it'll be it'll be a good year.
Awesome. Well, guys, you know, this season I have a new challenge called our Empowerment Challenge. So Megan is going to take the Empowerment Challenge today. Again, our 3 topics, and Megan, you get to choose one, is 1, reclaiming our identity, 2, mastering parenthood, or 3, re-identifying your God-given intuition. So which one, Megan, do you want to help empower our listeners on today?
Okay. I would love to do all 3, but today I'm going to choose mastering parenthood. And I think I would do mastering parenthood just to tell all moms out there that being a mom is really, really tough, and it can be really isolating and very lonely. And just to know that you are the perfect mom for your child. So everything that you are doing, you're doing it well and you're doing it right. And there is no perfection. So don't let anybody tell you they're the perfect mom, or, you know, that they're doing everything perfectly, because you're doing everything perfectly for your child.
I love that. So mamas, you hear that? Remember, you are perfect for your child. And I'm a firm believer in that, because God promises us He never gives us more than we can handle.
That's right.
Whatever is going on, that's right. Whatever is going on right now, you can do it. I love that. What a great, encouraging word that was. Thank you so much, Megan.
Absolutely.
And then finally, how can our listeners and audience connect with you?
Perfect. So on Instagram, I'm at Megan_toddler shop, and I give a ton of toddler tips, potty training, sleep behavior. So definitely check me out there. For my potty training website, it's pottyshopOC.com. And then toddler sleep, I'm at sleepshopoc.com/toddler shop.
All right. So you guys make sure you connect with Megan, support her. Again, for those who are watching, all her information is up on the screen. For those of you listening, it'll be in the notes. Make sure you follow her on Instagram at Megan_toddler shop. Make sure you purchase the first book, Yes You Can, Potty Training Manual, and then Part Poo. That's not what it's called. I'm calling it Part Poo.
Love it.
I think that's such a cute name. Part Poo is coming out for first-time moms. So make sure, if you know a first-time mom, to get her a copy of that. So make sure you do that. So Megan, thank you so much again for being such a special guest on the Dr. Mom Show today.
Thank you so much. It was a pleasure being here with you.
And of course, thank you everybody for listening and watching. You know, I always appreciate your support. If you haven't subscribed to the Dr. Mom Show YouTube channel, make sure you do that. Follow us on Facebook at the Dr. Mom Show, and of course on Instagram at Dr. Mom_show. And then of course, we just got plenty of books going on here. I'm so excited because at the end of this month, I'll be launching Dr. Mom's Ultimate Guide. Whoop, whoop. Woo! So excited. Dr. Mom's Ultimate Guide to Raising Happy, Healthy, and Safe Families. I'm doing it in collaboration with 2 other authors. Steve, and Mari, and I'm just super excited. This has been on my bucket list to do because you guys know I love helping moms like Megan. I just love her vibe. I love her energy, and I love her purpose because I feel everything we learn and go through, we should use to impact other people and teach other people, because why reinvent the wheel, right?
That's right. That's right. And we're raising the future.
That's right. So pre-order your copy of Dr. Mom's Ultimate Guide. That's on my website, drdeleenmushalak.com. And again, follow, make sure you get your freebies. And of course, remember, you can follow along if you enjoyed the empowerment challenge. You can join my female group, Fulfill Females, on Facebook. Check that out. Every week there's different challenges. It's just a fun place where we help encourage each other, but also have healthy choices on there because, you know, as mamas, it's hard to be healthy. Okay. It's hard because we're busy. So thank you so much again, Megan.
Thank you, and congratulations on your new book. How exciting.
Thank you. Maybe Megan and I will be doing something in the future.
That's right.
Maybe that'll be the part
Stay
2.
tuned.
I love it. So everybody, please don't forget, support Megan, follow her. And of course, remember, life is precious and priceless. You are amazing, and you can do anything you put your mind to because you are a superhero. Just have faith over fear. And of course, like Dr. Mom always says, don't forget to wash your hands, kiss your kids, love your families, and say your prayers. Good night. Love you from the Dr. Mom Show.
Bye.